Hello, I'm Dali, a hypnotherapist, pharmacist, and research student at the University of Queensland. This is Lucy, feeling powerless, distressed, scared of burns treatment, which increases her pain and suffering, delays her recovery, and reduces her compliance. This could be Lucy, empowered, confident, relaxed, pain free, cooperative, and trusting that clinicians are there to help her, which makes her feel better and fastens her recovery. How? Hypnotherapy for procedural pain, state anxiety, and itch in children with acute burns. Hypnotherapy involves providing suggestions that induce sensory, perceptual, cognitive, and behavioral alterations for therapeutic purposes. Due to burns and related treatment, children like Lucy experience pain, anxiety, and itch that can exacerbate each other and expose them to acute and chronic biopsychosocial problems. Reduced pain, anxiety, and itch can enhance healing, reduce the stress, prevent chronic biopsychosocial problems. Hypnotherapy is more effective than other non-pharmacological interventions for children's procedural pain, state anxiety, and itch, yet evidence is lacking in pediatric burns. This study aims to examine the feasibility, acceptability, reach, adoption, implementation, and effectiveness of hypnotherapy and study procedures. We will use a mixed methods design. Children presenting to the hospital for their first burn stressing change will be included with their English-speaking parents and clinicians if they fulfill all these inclusion criteria, and they will be excluded if they present with any of these exclusion criteria. Feasibility will be examined by resources adequacy, time availability, and potential disruptions. Acceptability will be assessed by satisfaction rates and feedback on the intervention. Implementation will be assessed by adherence to the fidelity checklist, completion of data collection, and retention rates. Effectiveness will be assessed by self-reports of pain, anxiety, and itch, physiological measures of pain and distress, reports of adverse events, and perceived benefits. Reach will be assessed by rate of families willing to participate, and adoption will be assessed by rates of clinicians willing to participate. After agreeing to participate, families will be offered a pre-hypnosis interview before their dressing change, followed by hypnotic suggestibility screening. Only children who score as medium to high suggestible will receive hypnotherapy during dressing changes until their wounds heal. Data on pain, anxiety, itch, wound healing, saliva samples, and pulse will be collected at baseline and following the intervention. This study is a first step toward further research investigating hypnotherapy in children with acute burns, examining hypnotic suggestibility screening and using mixed methods and multiple sources are unique aspects of the study, yet findings are related to the local context and may not generalize to other settings. Special thanks to my supervisors. Thank you.